be available in that archive.
Yes.
I have a question regarding the books, like why we pick up books and newspapers and we don't want to part with that. What is the emotional reason with this?
I don't know. The question is, what is the motivation that people pick up books and or newspapers and can't get rid of them?
I'd like to, that's a very, very good question, looking at why do people do that. And I don't want to be intrusive, but would you be willing to, if this is someone you know, to
I do it myself, that's why I'm here for.
Okay, so thank you very much for telling us that. I mean, is it okay if I ask you, turn it back to you, because it's so different, it's individual for everyone, what you think some of the thoughts are for you? Because I bet that it's not just you who has these thoughts about why you keep books.
I don't understand that if I don't read the newspaper, the sky is not going to fall, but the words will elected. I don't know what is exactly, I wonder about it. Like, I can't part with my books. My house is full of papers and books. And I'm in teaching profession.
Oh, so this is...
I hate it by the like how to, or even like if the book will go to good places, so I don't know where to send them, like all those kinds of things.
Yeah.
That's another question was there. Is there any list of the places where we can really discard, we can come and pick it up, because when you are growing older, around your 60s, so you don't know how to carry the stuff and go to them.
Let me answer the first part of that, and I just want to repeat the gist of it. So this person, someone who has many books, and they're very important to her, and she can't bear the thought of parting with them. And you mentioned that the ideas within the books are things you might worry you lose if you throw the books out. I have lots of patients right now who hoard books, and many of them are actually teachers, so it's interesting. But often the beliefs are, there's information in here that I will lose forever if I part with this. Even in the information age, people are worried they'll never find it again. Or this book says something about who I am. It's a part of me. If I give it up, I won't be me anymore. People will also think about how the book is an heirloom item, and you'll never find that same edition of a book in a store, and it's a valuable thing to keep. The problem is when that happens to every book you own, which is often the problem. The second question was about who would you give these books to? How do you get a charity maybe to pick them up? I don't know the answer to that. I might turn that to the audience if anyone knows. Someone has their hand up in the back.
I actually do this. I help people declutter.
Oh,
and
okay.
there are a number of resources. I just recently worked with a client whose father was a doctor and had a huge library. She had a huge library, so again, the genetics of the family and the daughter is the same. And a huge collection of art books. They went to the high school, one of the high schools that has a specialized art program. There are women's prisons. In terms of usable items, there are places like Red Door that will take linens and furniture items, that kind of thing like that. So there are places. There are some church groups that will take furniture to fix up and resell. So there are a number of resources of places where things can go. Women's prisons, some prisons programs, we can help other members of society by donating books to prisons, so inmates have an opportunity to gain a hold of that information as well.
Did people hear that? Okay. That's really helpful. Thank you. And we may ask you to stay for a bit.
And in terms of household items, a lot of the charities actually come past your house and will collect items on specified days. Canadian Diabetes, Canadian Paraplegic Association, Community Living are just some of the examples of different organizations. And if you call them up, they will let you know when they have a truck coming to your area. You put the stuff outside your front door and it's gone on the day that they specify they are coming, and they're really good about picking it up and reuse it. Yes?
Aren't you talking about clutter as opposed to hoarding? Because what I'm hearing is if you don't do therapy, you'll just reaccumulate anyway.
Yeah.
So
Yeah, you've got to start somewhere, and I think in the process of decluttering, of getting rid of things, people often have a hard time just throwing it in the garbage. And understandably, some of the items probably are in good condition, some aren't. But a lot of these organizations will collect stuff and they will sort through it and discard the items that cannot be used.
I think, can I add to, I just want to repeat the question that you asked, which was, by throwing things out, tell me if I've got this right, you're just decluttering but not fixing the root of the problem, really?
That was what I was getting from what you were presenting. This is where
It's true. So if you only discard and nothing else, some people actually get better, but very few. In the process of discarding, that's why we ask people to talk aloud while they're going through the process, because then we can look at the distorted thoughts that they have associated with the belongings and get at it from a deeper level. And then that process would be more likely to stick. Yeah. There are two people. We'll go here and then.
In answer to that, I was a great collector of books when I'm retired, so I needed time to decide to pass my professional stuff on to someone who could use it. But with books, what I do now is use the library more. So I'm not bringing it in from, I still get to read it, and the Kobo is also a good idea. It's not that I don't buy books occasionally, but I become far more discerning and do I want to refer to it a lot and keep it. And that has helped to, I guess, make a shift. It's like a shift in that area of my behavior.
Yeah, that makes a lot of sense. That's one thing we have people do. So this is someone who has started to use the library and then sorted through the books there to decide which ones are worth keeping and which ones can be brought back to the library. There's someone there who's had his hand up for a long time, so if we could.
Yeah, I was just going to say, isn't a big part of the problem feeling overwhelmed at a certain point where, you don't know where to start?
Yeah. Yeah, so the question is feeling overwhelmed, isn't that one of the biggest problems? Absolutely, and I guess I didn't emphasize this enough because of the lack of time, but what we do often to address that is we compartmentalize things to the nth degree. So we say, today you're going to work on decluttering the surface of this one chair, and tomorrow it'll be the surface of the kitchen table, or half the kitchen table, and you pick these goals, write them out, and proceed very systematically, because it is overwhelming. Is there anything to add to that?
Yeah, there's a wonderful acronym called SMART goals, and it stands for specific. So you're very specific, like the surface of the chair, measurable, that you can actually see what's been done, achievable or realistic, so you're not going to say, I'm going to clean my whole house today. And time, the T is for time limited, so you have to do it in a certain amount of time, and that's actually, I think, a helpful framework when you're doing the kind of things that you're talking about.
Could you repeat it slowly, please?
Yeah.
Specific, measurable, achievable or realistic, and time limited.
And I would just add to that that it should be in writing, because if it's in your head and you have these goals in your head, they will fall off to the wayside the moment you start. So also to write those things down.
The lady at the back.
I just wanted to share something, and of course I'm not coming from a clinical background, I'm coming from purely experiential in working with many clients. One of the things that I always work into the process right at the onset is what their life goals are that the cluttering and the hoarding is interfering with. Because that gives a positive, it's not just about getting rid of the stuff, it's what their space is going to be available to nurture and support them in where they want to go and what they want to experience. So this is a very important element. I just have one quick case study of mine. A gentleman, his wife had developed leukemia. He spent 2 years looking after her. After she passed, his mother passed very quickly after that. And he went into a severe depression. The condo was so bad, there were cockroach bodies everywhere in papers and everything, so I had to really roll my sleeves up and get to do that. He started to take a step out of this depression. He joined a genealogy group where he met a woman who he had an interest in. And it was actually the woman, she went to his place, and when she saw his place, she thought, oh my Lord, I've made a terrible mistake with this man. I thought he was a great guy, but look at how he's living. And I was working with a friend of hers, so they called me and brought me in. And because he had a goal, which was this woman, to be involved in having a life, he responded. And he was probably one of the best clients I ever had, because he was like, yes, let's get it going. And they got married, and they have a wonderful home together.
Thank you.
Art, and he had beautiful art pieces, which we were able to bring out of the closets. He spent a lot of time up north with the Inuits, so, you know.
Thank you very much. Thank you.
Here, who keeps putting
Yes.
their hand up, and I.
Okay, what happens if somebody, they're not a hoarder, but they're terribly disorganized and the demands on their time are so much that there just isn't the luxury of time to say, I'm going to do this or I'm going to do that. Where do you turn so somebody can either work with you and say, or even the talk therapy or support groups, like where do you turn?
Well, it's a very good question. A lot of people who hoard have this problem of feeling like there's just no time. And what we find, so actually I should ask first, should I repeat that question? Yeah? Okay, sorry. So the question was, what if it's someone who hoards but feels like there's no time in the day to do all the sorting and the therapy that needs to be done? It feels like there's never enough time. So what I was going to say about that is it's a very common problem in people who hoard to have that feeling that there's no time. And often what we find is those are the people who also have a component of OCD or obsessive compulsive disorder. So they spend a lot of time ruminating and thinking, and they're very slow accomplishing tasks because tasks have to be done just right. So I don't know if that's similar to what you're describing. Okay.
First of all, I don't take any medication and I have no OCD or any of these mental disorders. It's just that there's just so much that needs to be done on a daily basis that I can't stop. And I'm definitely not a hoarder according to the pictures that seen. It's just I'm terribly disorganized.
The disorganization is the biggest part of the problem for you. Yeah, so for that branch of people, it's harder. We had someone in our group like that recently describe things exactly the way you did, that she wasn't meeting criteria for hoarding or for OCD specifically, but there was just not enough time even to do the smallest task that we assigned as homework. And Dr. Richter, who runs the OCD clinic, she was my supervisor. She's a very strict therapist and actually sat down with this person and said, let's list out what you're doing every 10-minute slot of the day and figure out what parts of that can be altered and what you're doing that may not be necessary, what activities you're doing that could be changed on a daily basis to free up time. But it's a very difficult process, and it is a particular challenge that you have.
And what happens also if there's just limited energy to work with?
And limited energy, yeah. Things have to move very slowly. The therapy takes a lot longer. It is doable, but it takes a lot longer.
Where is this therapy being offered? Is that the CCT?
Yeah, we'll answer that last question, and I think we need to move on, but you can come up afterwards as well. This clinic is where we do assessments, and then we have group and individual therapy. There's a long waiting list, but you can get on the waiting list, and sometimes the groups, we're actually hoping that if we get enough people with hoarding, we're going to do a group just for hoarding, and even though you're not meeting criteria for that, as you say, I think you'd still fit in very well with that group. So please do ask for an assessment. I'm having trouble keeping track of who is when, who is where.
What if the hoarder is in denial and doesn't think he has a problem? And how do you shouldn't go in and obviously throw their things out, based on what you said earlier. How do you sort of stage an intervention or convince them that this is an issue? And if they're good at rationalizing, if they're good at
That's a very good question, too. I think we both probably have answers to that would complement each other. So the question was, what if there's someone who really just does not have insight into the fact that this is a problem and they'll rationalize their behaviors? How do you treat someone like that? This is where we tread into the area of medical ethics, really, because if someone is unaware that it's a problem, but there is no risk being posed, and they seem to be capable with respect to most decisions in life, it violates their autonomy to force treatment upon them. But if it's a situation where there's a public health issue or where there's a safety issue for the individual, let's say the hoarding involves clutter and the person has a risk of falls or fire hazards or those things, then you can forcibly send someone to the hospital for treatment on the basis that they'd be a danger to themselves or others. But there's this large murky ground in between, and it's a bit like the model they use for alcoholics. A lot of alcoholics don't realize that they're alcoholics. So what AA will say is the first step is admitting that you have the problem, and you spend a lot of time with that person, and hopefully they would see a therapist, and that therapist would spend a lot of time with them on just getting them to recognize that it's a problem. But that first step will take a long time for some people.
But let's say just marital discord. What do you say to the person to try to get their attention that this is a problem?
I have to think about that for a moment. Yeah.
I don't know that there's an easy answer. I think part of what we discussed in the talk was setting limits. So if it's a partner of someone who is hoarding, then you have to decide what are you willing and able to live with. The person may not change no matter how adamant you are that they should. And it, as Justine said, it's a very long, slow process, and the only time that you can exert any kind of forcible change is if, as she said, if there's a hazard, either to the person or to others.
There's a technique known as motivational interviewing, which therapists usually do with clients, but family members can also learn to do with people. And it's one of the ways of getting someone to realize there's a problem. You may ask questions like, what is this behavior? What role is this behavior functioning as in your life? What role does it have? What are your goals in life? And is this behavior interfering with your goals or not? And the person's goals may be to stay with the spouse. And so in a way, this behavior could be interfering with that goal. So if you get someone to talk about it, and one very effective question is you ask them, why should you give up this disorder? Let's assume you shouldn't. Instead of pushing you to do it, you take the opposite track, and they can actually give you the opposite reasons. It's a type of reverse psychology. But in motivational interviewing, sometimes that works well. I don't know if that's helpful at all. Yeah.
I guess WTF is moved to a brother.
Perhaps. Yeah. There's someone back.
Whether or not it's covered by OHIP, this treatment, and who else is doing treatment?
Yeah, the question is our treatment covered by OHIP, and who else in the city is doing treatment? Psychiatrists and GP psychotherapists are covered by OHIP, and so I'm covered by OHIP, Dr. Richter is, and some of our colleagues, but registered psychologists, social workers, and some occupational therapists are not covered by OHIP. At our clinic at Sunnybrook, you would be seen by a psychiatrist who's covered by OHIP, but for therapy, the waiting list for OHIP covered is much longer than the waiting list for community therapists, and we have a list for those who can afford it. We have quite a long list of therapists all around the city of Toronto who have sliding scale fees of various varieties, who do very good behavioral work with people who hoard. So if you'd like, please come up and I'll give you my contact information for that list. Yeah.
Do you have connection with the fire marshal? We attempted in our community to open it up that way, to if a fire marshal came in and then possibly the person would see, okay, there is maybe a safety issue. And we attempted to phone, and we didn't have any luck. We were getting a lot of no answers. Do you have a referral in that area?
The question is, are we connected to the fire marshal, and do we collaborate, I guess, with them? Our group has given, the Sunnybrook group anyway, has given many talks to the fire marshals of different communities around Ontario, but we don't have a direct link. I don't know if you at Baycrest have.
No, I was just going to say that I think trying to collaborate and work with them is probably ideal, particularly because fire hazards are so common. And I think it certainly does vary from area to area. In the initial talk that I went to last June, they did have someone from the fire department there, and they said it really does depend on the community that you live in. Unfortunately, there's not a uniform response to this.
Yeah, that's what we know too.
I just want to make a comment about the specific of information hoarding, books, magazines that was mentioned, and I think from my experience, and why it's so prevalent among teachers and professionals, I would say, is because you recognize the value of the information, and so it's just, the idea of tossing something that's in usable form, as you said, is just so almost impossible to do, and I really did find that is something that is changing, or my son was helping me to change, because now that we are into that age where books are really old, they get out of date, the internet doesn't. Of course, you can't just read it on the internet, even though it's changing all the time. You have to copy it, right? You have to copy it and save until you get over that. But these are much smaller. I mean, we hoard on computers too. It's just that you can save so much more information. Everybody's got terabyte. You've got those 2 terabyte drives and everything, right? But you can save so much, and I think that's the change. In addition to using the library and not buying the books at the library, but I guess the point that I found is I had to stop getting newspapers because I could not get rid of them. They're all too interesting. But if you stop bringing the stuff in, that's the only way that I found with information that you can deal with it. So we're old enough now that we've got stuff that we need to get rid of, but the younger people won't be acquiring it quite as much. Not that kind of material anyway. They'll get
Something different. Did people hear that? Okay? Yeah? I think that's a very important point, and what I'd add to that is, about the newspapers, things are so interesting. But what happened is when you stopped acquiring, you didn't say that you feel that there's a deficit in your life as a result, and that's an example of a cognitive reappraisal, if we want to use you as an example. Okay.
The gentleman with the glasses.
I wanted to ask what role peer support groups have in treatment.
Oh, question about the role of peer support groups and self-help groups, I guess, too. There are lots of groups in Toronto. I'm fairly new in the field, and Dr. Richter is the expert, and she has said there's one group only that she knows that is really good and really reliable, and it's called Rick's Group. Has anyone heard of this? Yeah? Okay. Yeah, so this is a group that meets downtown once a month. Say that again? 130 Jarvis. This is Rick's condo. Carlton. Okay. I have this information if anyone wants it. And it's called Rick's Group. I'm sure you can find them online, but we actually have a handout we give people, and I can email that to anyone who wants it. It's an OCD group, but as this person at the back was saying, there are hoarding people in that group. The only other groups we know of are the treatment groups. Maybe Suzanne knows of some others? No, I mean, if you join a CBT group or treatment group, you'll find that the people in there all struggle with the same issues, and it's a kind of support at the same time as treatment. But you can only join those groups if your goal is treatment, whereas Rick's group, you can join just to have a community of people who understand you a bit better. So if anyone wants that information, come up at the end, and I will give you my information, my contact information. And there was someone, okay.
Yes. You didn't get into the condition in the brain, like how it looks when you can read the brain to see people that have this condition. I'm just wondering if it's a natural thing that just gets out of control. Like we need things, so we have to have possessions, that are useful. And can that just get knocked out of alignment somehow?
So you're asking two questions, really. I think one is, doesn't it make sense that we acquire things because from an evolutionary standpoint, we do need some possessions? And the other question is we didn't talk much about the brain abnormalities. Are there parts of the brain that show differences? Am I getting that right?
Yeah. Could most anybody get into this in a certain situation?
Oh, yeah, or could almost anyone in a certain, okay. So I'll try to summarize my answer to that because it's complex. But, I mean, going back to that slide, it's very strange looking at it. I couldn't go into it into a lot of detail today. We know there are brain regions that account for hoarding and that they are abnormal. Here's the slide. I can't go through it in a lot of detail now, but one part of the brain called the caudate, the nucleus, it's a deeper brain structure. It is smaller and more active in people with OCD and hoarding, and the anterior cingulum is also abnormal. So you can look at a PET scan or an MRI, but not in everyone. Some people who hoard have no visible abnormalities at all. And yes, from an evolutionary standpoint, hoarding is an anxiety disorder. versus impulse control disorder, but there's a strong anxiety component, and we know that we need anxiety to survive as a species, because back in the day when we're in a cave, you need to be anxious about bears being outside, and so to some degree it's adaptive, but the point is, when it gets to the point that it's beyond adaptive, that it causes harm, that's when it's a disease or an abnormality. So we all do have that tendency, and this is why people who are exposed to deprivation, environmental deprivation, or things being removed, are more likely to develop hoarding than those who aren't. Does that answer that question? Yeah.
Weren't you saying about this also, there was the sort of chicken and the egg thing, like whether these, like, have they ever done studies of people like right from 13 years old or 10 years old?
No. So the question is, have there been, because of the chicken and egg issue with these brain studies, the fact that we get them from older people who already have the disorder, the problem is we don't know which of those children are going to develop. You'd have to take a group of normal children without any symptoms and then do a serial MRI scan, and we don't know what the long-term health risks of that are, so those studies are not approved by ethics boards usually. So no, we don't really have that kind of data. It's a good question. Do we have time for 2 more? Yeah?
2 more? So you said that, we can refer by the doctor, but then is there any limited age group or something, or anybody is welcome?
And so the question is there an age limit for the referrals to Sunnybrook? We don't have an age limit. There's even a youth service at Sunnybrook, which isn't directly part of our clinic, but they refer to us all the time. And is there an age limit for you? No. Or, no. Okay.
And last question.
To what extent is hoarding a learned behavior? You talked about Holocaust victims in hoarding and said that the pattern was repeated in second and third generations. And I wondered if that was potentially learned behavior as opposed to genetic.
Yeah, that's a very good question. Did people hear that okay? No, so I'll repeat it just quickly. The question is hoarding ever a learned behavior as opposed to genetic? That if someone in childhood is exposed to someone hoarding, will they learn that behavior from them? Or if they're exposed to deprivation, is that how they learn the behavior? I'll answer, and you may also have an answer. There's what's called the social learning theory. When you think about people who are afraid of dogs, many of them have parents who were also afraid of dogs, and they learn to be afraid of dogs from their parents, and that's a direct association. But most of them also have a family history of anxiety disorders, and there is a genetic component. Very much the same for hoarding. So if someone's parents hoard, like my patient, Ms. H, the one with all the dumpsters, because both of her parents hoarded, she clearly did, at least to some degree, learn that behavior from them. So there's definitely a component, but it doesn't explain all of the people who develop hoarding, because a lot of people who develop it have no background with parents who hoard or with trauma or deprivation.
I would reiterate that, and in most things in life aren't really simple and clear-cut, so there's often a combination of genetics and learned behavior. Thank you.
Thank you. Thank you both very much for this very informative lecture. There was so much that was presented. I'm sure you're all, maybe you'd like me to repeat that, Ontario Telemedicine Network, and you can certainly view it as many times as you wish, but just give it about 3 weeks or so to get up there loaded onto the net. We really appreciate your coming today, and this audience clearly was very engaged in everything you had to say, so maybe we do have to talk about a return appearance sometime. Yeah? Okay.
Thank you.
Thank you.